And now, something I know that will interest all of you as we live through these unprecedented times, it's our panel discussion, the impact of the pandemic on the mental health of children and adults. And to moderate, as always, once again, here's Dr. Terry Constantine. Terry?
Thank you again, Rob. I would like to introduce our panelists who are well-known researchers in the field of mental health. Dr. Julie Carbray is a clinical professor of psychiatry and nursing at the University of Illinois at Chicago. In addition to being the director of the Pediatric Mood Disorder Clinic at UIC, she was also a consultant to the Chicago Police Department to develop training curricula for officers responding to situations involving children and adolescents with mental illness. Dr. Royce Lee is an associate professor of psychiatry and behavioral neuroscience at the University of Chicago. Dr. Lee is actually a past recipient of 2 BRF seed grants, and with those grants, he's obtained over $1.5 million to further his research. While his research focus has expanded, he still is following up on some of the areas BRF supported around resilience and stress. We are very pleased to have both of you with us. The first thing I would like us to do is to try to remember our lives before the pandemic, way back in 2019, and compare it to now, 2021. How much has this impacted our mental health? Dr. Carbray, how are children and adolescents doing?
This has been a very challenging time for children and adolescents. Even prior to the pandemic, we had numbers that were creeping up for adolescents who have taken their lives by suicide. We also were well aware that our workforce for meeting the needs of children and adolescents was really quite thin. And I think the pandemic has really exposed some of those challenges. We've seen more children going to the emergency room for mental health services due to some of those workforce issues. And we've seen some alarms that have really gone off, letting us know that children and adolescents are suffering. So much so that just recently, this past month, a state of emergency for the mental health needs of our nation was actually sirened by a paper that came out indicating that we really need to do much more to meet current needs of children and adolescents across our United States.
Thank you, Julie. And Dr. Lee, let me turn it over to you. How stressed are adults right now?
Yeah, that's a good question. I think the answer is pretty stressed at a simple level. Looking at the question, there are a couple sources of knowledge here. One is our own experience and the experience of our family and friends. And anecdotally, I hear things are stressful and I experience that too. Then there is data collection by the government and also by researchers. And I think paralleling what we see in children, most data from adults nationally and internationally indicate both increased subjective stress and also an increase in the intensity and, let's say, prevalence of psychiatric disorders that are stress related. So I think those two things are going together, and most of the data is suggesting that we're seeing both increased experiences of stress as well as actual psychiatric disorders that are closely related to stress.
And Royce, when we say we're stressed, I say I'm stressed. I tell my kids, you're stressing me out. What does that mean, though? What can stress cause? How is it manifested?
Mm-hmm. Yeah, good question. I think we understand stress primarily through our emotions. And so, I think when we ask most people, what is it like to be stressed? And people will come up with good descriptions of what we generally see, right? So fear, anger, worry, those are often the emotions that come up. And then if we look a little deeper, there's other things that go along with stress that maybe we don't initially notice. Some of those things are inside of our body, like inflammation or the release of stress hormones. Some of these things are inside of our head, like we may connect what we're going through now with a past experience we had. And then some of these things about stress are not within ourselves, but how we relate to other people. And so I think one of the more Difficult things about stress is how it affects society and how it affects how people communicate with each other and stay connected with each other. So that's my kind of complicated answer. But stress has this kind of spider web of effects, some of which we're very, very familiar with intuitively, and others we may only notice if pointed out to us.
And Julie, I mean, does stress affect, are we seeing the same thing in children?
Indeed, we are. And I think some of what Royce was discussing, we might see differently in children. They may not eagerly share their stress. So instead, they may have symptoms of like a headache or a stomach ache, or they might be more connected to their parents, sort of clingy, and demonstrate outwardly what they may be experiencing inwardly. Within their social relationships, they may be more irritable. And rather than having the language sometimes to articulate what they're experiencing, they'll show it with their behavior. And so that's the challenge for parents, is trying to sleuth, what is my child experiencing right now? And the largest question we've experienced has been, is this pandemic stress, or is this normal developmental stress, or is this a mental illness that we're beginning to see? And how to help parents navigate that is critical. I just one more point on that too, is that children look to their parents too to mediate their stress. And if parents are exhibiting their own stress, which, it's hard to contain, especially during the pandemic when there's been isolation and families have been together, children sort of look to their parents to help them understand, how do you manage stress? How do we talk about stress? And so for families, it's very important to understand that role that parents have in helping to mediate stress in their children's lives. And we have some good literature that really points to helping parents, of course, helps their children.
Well, I mean, I think I want to try to elaborate that a little bit, right? Like, if I'm a parent and I'm looking at my kids and they say they have a headache, how do you know it's a headache because, they are really stressed, or they didn't drink enough water, they didn't eat today? How do you pull it apart? It is harder, especially like you said, with children that aren't that are very young, that can't articulate, or even older kids that perhaps, they want to stay in their room as a teen. How does a parent really try to figure this out and tease it apart?
Well, and parents know their children best. And so when, as a parent, you begin to see a pattern of behavior, then it's important to note that pattern, maybe starting to jot down, how often are these headaches happening? Do they happen on Mondays? Do they seem to happen when they have too many asks? And if the child's unable to put those pieces together, often a parent can help build the bridge to understanding what some of those stresses may be, and then pose those questions to their child, and making some of those connections in a very, of course, conversational way.
And Royce, let me ask you about adults. I mean, we have, gender differences, male, female, parents, caregivers, married, single. Are there certain groups that are handling this stress better or not?
Yeah, that's a good question. So we do have data on this, and I think probably the largest data sets come from the CDC and the Kaiser Family Foundation. And the data, I think, converge pretty clearly. So generally, there are differences in the sort of intensity of experienced stress in the population. Some of the key differences that we're seeing is, I think, as Dr. Carbray pointed out, we're seeing a signal in younger people. That maybe is kind of surprising, actually. I'm not sure I would have expected that. I would have thought younger people would have been shielded, but there's a clear signal there. Essential workers, we're seeing, it's fair to say, alarming levels of PTSD and depression in this population. There are social inequities in society and how stress is experienced, and we're seeing that in the data too. Females are experiencing higher levels of stress and its repercussions, and that includes when you subdivide and, let's say, look within even essential workers. Female essential workers are experiencing higher levels of stress. So those are some of the major sort of categories we're seeing some data supporting.
And then I have a follow-up on that because I'm thinking about the female angle. If they're female but not, if they don't have a family, are they less stressed, or it's females across the board? I'm trying to think, like, is it just because they have maybe more jobs or more things that they need to be doing, instead of, a single female, even healthcare worker, nurse, or someone?
Yeah, that's a good question. So I think at the biological level, there are gender differences in how the stress systems work. But as you're pointing out, we have to be careful when we look at data in humans. Human society emerges from biology, but also shapes it. So I don't think I can give you a definitive answer, but I think all evidence points to the more complex role that women have in society as accounting for at least a large part of that difference in experienced stress.
And what about children? Is there a difference with gender, or, if they have siblings, only child with siblings, one parent, are we seeing any differences there?
Well, what we do know about children is that children from diverse environments are showing more strain and more impact of the pandemic on their lives. Um, as you may be aware, many children have lost primary caregivers throughout the pandemic. They've also lost a whole year of being in school, if not more. And so there's compounded grief. And in this already challenging environment of children who have less access to healthcare, to means by which to aid their recovery, we're seeing, of course, higher rates of mental illness and need in those populations. So that we know. But along gender roles, I'm not aware of any differential separation right now with where data is coming.
I mean, I know one of the biggest thing is isolation, right? And children were kind of isolated, from their peers, playing, recess, all of this. But now they're starting to go back to school. And how important is it that children are back in school?
Reconnecting with that fabric of routine, connecting with social networks, re-engaging and learning in activities has really been a robust perk for kids during this time. But of course, it's required a lot of family juggling. Not all parents are back at work. Some parents are still struggling with childcare. And so I think although there have been some exciting new opportunities for children, there are still some challenges for families. The bulk of children that we're seeing in our clinics are pretty excited to be back in school, but we do have some of those kids who were very comfortable during the pandemic, not having to put on clothes and go to school in ways that they know it. So it really depends upon the temperament and the personality of those children and how connected they might have been to the social web of their school environment or not, as to how they manage that reconnecting with school. But overall, there's been a positive effect.
But getting back to school can be a stressor for certain kids.
Absolutely. And in our clinical environment, we've also found, and some of this data, of course, is now coming out to support this, that our children who might have had more anxious, introverted personalities prior to the pandemic were pretty comfortable being at home. I mean, they were in an environment where they had what they needed and didn't have some of those stresses. But children who easily engaged in social networks and appreciated being in the school environment navigated that change very differently. It was more challenging for them, and they were really struggling not having that structure.
And I think you touched upon this. How are, adults that are struggling or parents that are struggling, how can they help kids that are struggling? We're all in this, unfortunately, together, or fortunately, I guess. But, parents are under stress for the pandemic for different reasons, but nonetheless, still major stressors. Dr. Lee, can you tell me, like, how as adults and caregivers, can we help the kids that are really struggling and ourselves?
Yeah, well, I tend to give kind of wonky answers, so I'll sort of stick to that, stick to my story. I I like to think of things sort of systemically, starting from the biology, because I think it can be helpful. And what I would say is that we have prior data from other pandemics on how the population has fared. And we know that viral pandemics affect the population at a large time scale. So we measure that in years. We know viral pandemics affect the population at the immune level and cause important biological changes through exposure to the virus. And we know that from prior pandemics that they demand the population be very flexible cognitively. That is, the way to stay good is to change. Right? Resilience, we like to think of as like memory foam, right? So we want the foam to bounce back to the exact shape it was before. But we know from studying highly stressed out people, let's say in the military, healthcare workers, that the process of resilience is a biological process whereby we change in preparation for the future. So to get back to the question, I think the pandemic has forced all of us as parents to be extremely quick on our feet, to be able to change our minds about things, right? And to be able to cooperate with others in changing our minds in a way that hopefully, right, converges on some kind of consensus and is reasonable. And sometimes we have to give up things that we don't want to give up. So that's as short as an answer I can give. That we have to be prepared to change, continue to change, and look for the positive side of things. We do this a lot with healthcare workers in resilience training. If we're always focused on what we've lost, and that there's a genuine reason for grieving, I agree. But simply focusing on the loss is perhaps not the best way to go forward. Rather, looking at what we've learned, what are the positive aspects of the experience. Those are things that can help us with these kinds of changes.
But I think, and correct me if I'm wrong, certain people are more resilient than others, right? And so, one, can you identify those people, as perhaps as children, the ones that you feel may be resilient as children, are they also the ones that grow up and they're resilient? And then two, how can you help the ones that aren't as resilient to be more positive and, not dwelling in the past, looking forward, hopefully? And so maybe, Julie, I'll start with you with the children.
Yeah, I think as parents, we help our children to build that resilience muscle. And I think some of that happens by how families model their experiences, being able to have a time and place maybe to talk about grief in ways that children do, but then being able to shift gears and focus on recovery and on resilience. So moving into building structures where there are fun experiences for parents and children despite the pandemic. And we've heard, I'm sure many of you have heard wonderful stories about families that adopted new routines while they were home during the pandemic, and were able to walk away with some silver linings around times that they shared as a family. And I think we'll continue to see that. We're seeing that in school settings. I understand teachers have been told, please give a lot of grace to these children. They're grieving educational losses, family losses. And so in our environments, how do we make school a safe place for kids to come, connect, and again, be open to ways in which they'll see resilience? And so kids, again, connecting with activities that show the best strengths that they have, parents modeling that and encouraging it, whether it's through social connections and their own ability to shift gears and not stay in that zone of talking about the grief, but rather building that resiliency with grace.
So that seems like a lot of stress for parents, right? That they have to be the role models. And so how can they do that, Dr. Lee?
Good question. Well, so first, The first step to resilience is a skill that we talk about with healthcare workers. It's self-compassion, right? That is the ability to view yourself favorably and in a way that's helpful, like to be able to sort of offer help to yourself. So, what is self-compassion during a pandemic? This is what I tell some of the patients that I see. The problem that you've had is not a problem with coping. It's not a poor choice you've made. What you have is an inflammatory disorder. And I mean that literally when I talk to my neuropsychiatric cases, whether it's COVID psychosis or let's say PTSD that's gotten worse with COVID or depression that's worsened during the illness. There's just inflammation all over. And sometimes our brain drives the inflammation, sometimes the virus does, or sometimes maybe even the fear of contracting a virus. That's one of the effects of the inflammatory system. So, to get to the simpler part of the answer, um, my research with the BRF was focused on how stress affects us. And the simple answer is it makes us mistrustful. And the path back to resilience, both within individuals, families, workplaces, and systems, is to really work against that mistrust that the immune system and stress hormones tend to push us towards. So when we think of some people that have more trouble with stress, many of these people have had traumatic experiences previously. And what happens with a trauma is it tends to prepare us for the same kind of thing in the future. And that can be helpful, right? That's why we genetically can have a disorder like post traumatic stress disorder. But it can also constrain us and make us expect the worst always. So, in terms of, as parents and adults working on resilience, staying hopeful, right? Learning from past traumas, but not accepting that they have to repeat again. And then working against mistrust towards increased connections and trust. As Dr. Carbray pointed out, the easiest way towards this is positive activities, very simple things like nothing tricky, just going out and doing something with friends outside, playing some kind of game. With healthcare workers, we do silly things like, "What's your favorite ice cream? Can you say something nice about the person sitting next to you?" Very simple things. Those are the way to build back that trust, and I think that's the fastest path for most adults towards resilience.
And there are a lot of other ways to kind of, simple things you can do to try to cope with stress, like, take care of yourself and your body, right? Exercise, eat well, get sleep if you can, hopefully. Get off those screens. We're on them right now, right? I'm going to get off after this and, go hopefully chat with some people. Dr. Carbray, what are one or two realistic and really important things that you can do for children to help them de-stress as they're going through this?
Children really appreciate routines in their life. And the pandemic, as Dr. Lee noted, threw all sorts of curveballs in the face of children that really challenged bedtimes and the way that kids ate and connected with others. And so establishing some new routines really helps kids to ground themselves in their day, in their work, and in their play. And then, of course, supportive and caring relationships and facilitating any connects, whether it's virtual or in person, is very important too. And really, as adults, trying to help kids to navigate those reconnects as we're moving forward through this pandemic is critical.
And so those rely on families or adults, right? Is there something that you would tell adolescents, somebody that, or teens, that they could do themselves that would be, helpful in coping?
Yeah, I think that teens are very used to the virtual environment, and I've seen a lot more connectedness with teens because they're used to a lot of the technology that younger children didn't have access to, or as adults, we had to learn. So being back in school, one of the things that will also help is reconnects, maybe with new peers. and beyond that virtual space. And that's been a point of new navigation for teens, is now being in a live space. How do I connect with people that I haven't been in connection with for some time? And really taking a risk, usually around activities or shared interests, in trying to establish a connection with a teacher, even with with peers. Or now that schools are back up and running, there's some great contacts in terms of re-engaging with mental health professionals, kids we're in contact with, coaches, things, people being back in school has been very invigorating for many kids, because they now can see their choir director or their baseball coach in ways that they weren't able to before. So just really trying to support them in the reconnect.
And so, I mean, many of these things seem like they can be something that we can translate and move forward for adults as well. So I would ask you, Dr. Lee, is there one or two or a couple of the really important things that adults should be doing to help them cope with stress and this pandemic?
Yeah, absolutely. Well, so, Terry, you mentioned some of these already, and I think they bear repeating. So, taking care of your body comes first, actually, right? So, exercise, nutrition, they seem so basic, but really are key, because our entire brain system and mind is based on the metabolic system, very closely tied to inflammation. So, taking care of your body is a really good idea for resilience. I like the phrase "take a risk," and during the pandemic, saying that, what we mean, of course, is be careful with social distancing, but be open-minded about what you still can do, right? So reaching out to do certain activities that maybe you haven't done before. It's that kind of break and gas issue of being careful with COVID, and yet reaching out and trying new things. And then finally, sometimes get a therapist, right? So the pandemic, telehealth, all of these things have changed the way the public approaches mental health. And so if you see a psychiatrist like me, I'll tell you, you're not crazy. You just have some inflammation. We're going to work on the inflammation with exercise, some mind exercises, maybe meds and therapy. So that issue of mental health stigma, right? It's not about being crazy. It's just a little inflammation, and there are measures to reduce it. So being kind of practical about how we view mental health, just like we view physical health.
And then I would kind of ask a closing question. I mean, look, it feels like a long time for this pandemic. People are ready for it to be over. And it will be eventually. We've got through it before, 1918, the Spanish flu, where a third of the world's population was affected. But perhaps, once we do get through it, there might be a light at the end of the tunnel, not just because the pandemic is over, but because hopefully it will shed some light on mental health issues. And so I would ask both of you, do you think we're going to be learning something from this, hopefully? Julie? I'll ask you first.
Yeah, I would say shame on us if we don't learn from this pandemic. I think it's really helped, as Dr. Lee has already noted, to shine a light on accessibility. Telehealth has really helped to shift the way in which that we can have outreach for those in need. The other thing I think that a light has been shown on, and particularly in the arena of children and adolescents, is that we need to do better for different levels of care and access for children and families, beyond the school setting, moving more into community screening and more ways that we might be able to reach out to children moving forward. And then I think this whole conversation about resiliency is something that I think will help guide a lot of what we'll be doing moving forward. How do we all make this time in our lives something that we learn from?
And Dr. Lee, the same question.
Yeah, I think there's a lot of reasons to be optimistic. Both about the pandemic and human nature and American society. For all the talk about mistrust, I think being realistic about the challenge that we have faced as a country, and our ability to mostly work together, right, to help each other and prevent things from completely falling apart, I think we've learned a lot. And like stress in general, it prepares us for the next thing. And so, with some regret, but have some lessons learned, we're better prepared for the future.
Well, I know Brain Research Foundation will continue to fund research into these issues, and hopefully there'll be increased funding for mental health care as well. And so I'm going to end on that. I think that's a really positive note because I want to leave some time for Q&A, and I do have a couple of questions. The first one is for Dr. Lee, and it's, we kind of talked about everyone in general, but let's now talk more specifically about people. There are people that, going into a pandemic were having issues, right? And so how are they doing? People that already had anxiety and depression and knew it, how are they faring during a pandemic?
Yeah. So we do have data nationally on this, and what we can say is that psychiatric patients had more trouble. They had more trouble with COVID. They had a higher mortality rate, were more likely to get it. Certain subgroups had particular problems. We know that people with psychotic disorders, their prognosis worsened during the pandemic. And we've seen that at the research level, but also, at the individual human level. There is a little sliver of the people I see that were already fairly socially isolated, used to it, and had kind of pre-pandemic resiliency training. And they did okay for a bit, but I would say after the first year, it got a little much for them too. So as a whole, more trouble. And so if you have a family or loved one with a mental health disorder, you probably noticed they needed more support through the pandemic, and that's what we've seen nationwide. And then there's the issue of COVID-related neuropsychiatric illness, which is a very real thing, and we've seen quite a bit of that. And that's required us to learn very quickly as a field about these kind of new psychiatric problems related to COVID. And I think as a field, we've done our best. And luckily, most of those cases seem to do better over time.
And what about children that had issues prior to the pandemic?
Yeah, so preliminary data shows very similar to what Dr. Lee is noting, and that is if children already were struggling with anxiety or symptoms of depression or severe mental illness, we saw a worsening of symptoms that really lent for more support. The other issue is that we've seen an uptick in substance use and in substance use disorders throughout the pandemic. And so again, another light has shone on an area where we need to do better, especially during a time of isolation and in helping to mitigate some of the precursors to substance use disorders in a developing population, like children, adolescents. So that's also been an important newer development.
And I think, Dr. Lee, you mentioned it earlier that, telehealth has been helpful. Is it helpful in most cases, all cases, or for certain, people?
Uh-huh. Yeah, right. There are certainly downsides to it. The upsides are increased availability. And, for example, I'm mostly working during the day. And what I notice from a lot of my clients, who I shall not name, they're often at work, and that's good, right? That means they haven't had to take a half day off work to travel and park in our huge garage and that kind of stuff. That's good. It's a good thing for society. That being said, I do have some sad stories too about people who needed wraparound services. And we've done our best sending nurses to people's houses, home health aides, even in-home counseling. So there's a portion of the population where telehealth is not the right answer. But in terms of large numbers of people being seen with relative convenience, I think it's been a plus.
And how is it working with children?
Yeah, I would agree. Imagine a family who has one child who's been struggling packing up their car for an appointment for their one child and having to navigate all of those schedules. So convenience definitely has taken away one obstacle to care. There needs to be a time and a place set for a telehealth visit, and that can be challenging within a family setting. And I can say it's been mostly positive, but I too have had those times where a parent will leave the child with some privacy, and I'm pretty sure that I'm competing against Fortnite or something else that's available and easily accessible on the child's screen, which really deters from their typical availability in an in-person visit. And so we've been able to navigate that with families and bring kids back into in-person visits if it's really not the best treatment environment for them to be over telehealth.
And then I have one closing question for both of you. Will the effects and impact of this pandemic ever subside? Will we get back to normalcy? Julie?
That's a great question. So we have this collective experience, many of us who have walked through this with loss, some with more traumatic effects than others. And so we have a collective memory, and in time we'll see what that does. If it helps to build that resilience muscle, as we talked about before, of some of the connectedness that we hope will be more valued coming out of this pandemic, we'll be able to outweigh some of those challenges of quickly shifting, as Dr. Lee said, that we've had to do throughout the pandemic. So yeah, my hope is that we will, but it will have left a mark.
And I'm just wondering, is it going to leave a mark for children more than a mark for adults? And depending on the age, because this is a really traumatic thing to go through when you're younger. As an adult as well, but I would think as a child, it is pretty traumatic, the isolation and all of that, the stress.
Well, and kids can be quite resilient.
Okay.
And again, it depends upon families and sort of how families have helped to buffer this experience throughout the pandemic and their ability to do so given their means. So I think we'll see some differences across populations in our recovery.
And what about adults, Dr. Lee?
Yeah, there's a lot of reason for hope. The historical data shows that about a year or two after a pandemic, most of the mental health measures return back to normal. There's a Lancet group that's looking at data at a very kind of a fine time scale of about month to month. And their data shows a pretty substantial recovery in general health, mental health in the last few months, as things have improved in most places, as we know, not all. And then I think generally, what we can say about stress, the immune system, and what we might call psychiatric disorders, it's all just a bit of inflammation. And the reason for that inflammation is to help us be changeable. So if we had problems in the past, that doesn't mean we have problems in the future. That's just the way the body works. And yeah, I think things will bounce back.
Well, I think that's pretty positive, and I think that's where we should probably land, right? You told us to be positive, Dr. Lee, and so I think that's where this panel discussion should end. And I want to thank you both for joining us. I think this was an extremely interesting conversation. I know I learned a lot, and I hope the viewers did too. And thank you again for being with us this evening.
It was great being here. Thank you.
Thank you.
Yeah, thank you.
Thanks, Terry, Julie, and Royce for sharing that important information. What a wonderful and insightful discussion. And thank you all for tuning into our second annual virtual event. We hope to be back in person next year. We are grateful for your time and trust you feel it was well spent. Before we go, we want to put that donation information on the screen once again. We're hopeful that after watching, you're even more inclined to give at the brf.org/donate. And one last thing, if you know of some friends or colleagues who you think might be interested in hearing about BRF, the program you've just watched will live on. Encourage them to take a look at it anytime on BRF's website or YouTube channel. Thank you for joining us. Good night, take care, and we'll see you back in person next year.